Thank you, Mr. Speaker. It's now been more than 5 years since President Obama signed his landmark achievement, which he called the Affordable Care Act, into law. At that time, the President and the Democrats in Congress promised that their massive federal takeover of our health care system would lower costs on American families. Affordability was its central selling point. But 5 years later, they must face the facts. Their law, which they forced on the American people, is a failure. According to yesterday's much-anticipated Congressional Budget Office reports, an independent agency, insurance premiums are expected to increase even more significantly next year than they did this year. One insurer in New Mexico, Blue Cross and Blue Shield, called for a 50% increase in premiums. And New Mexico is just the tip of the iceberg. Tennessee is also seeking an increase of 30%. The average West Virginia family, the state I'm blessed to represent, pays about the same as the residents in the state of New York, which is $17,105 a year on their health insurance. That's $271 above the national average. We cannot pretend that the Affordable Care Act is anywhere close to affordable. Obamacare adds taxes, regulations, and unfunded mandates onto the American consumers. The limited choice in health insurance plans is harming families and their budgets. In my district in West Virginia, there was only one insurance provider through the exchange, and this one plan is asking for a rate increase as high as 21.6%. President Obama has routinely and blatantly forced his failed policies on the American people. According again to the Independent Congressional Budget Office report of February 4th of 2014, Obamacare has killed 2.5 million jobs a year. Who are these 2.5 million Americans who've lost their jobs thanks to Obamacare? They're disproportionately low-wage workers. The people who are hurt the most by Obamacare are the same ones that Obamacare was supposed to help. What we really should call it is the Non-Affordable Care Act. West Virginians who get their health care insurance through their work are paying some of the highest rates in the United States for premiums and deductibles, according to a report from the Commonwealth Fund. The 33,421 West Virginians that are currently enrolled in Obamacare cannot afford to have their rates hiked yet again. Many Americans are left wondering how much more will we have to pay each year because of the Non-Affordable Care Act. To make matters worse, the Non-Affordable Care Act has added $1 trillion in tax increases. This is money taken out of the pockets of hardworking American families. The top Democrat leader here in Congress famously said on March 10th of 2010, quote, "We have to pass the Affordable Care Act to find out what's in it." You should know what it is before you vote on it. Come on. Well, it's been 5 years since the bill was shoved through Congress, and the American people deserve better. We must halt Obama's takeover of the U.S. healthcare system and pass common sense reforms that lowers costs for hardworking families and expands access to health care. The state of West Virginia and the nation need lower costs and personal control over health care decisions, not more federal government intervention. The budget that was recently passed by the House and the Senate repealed Obamacare, including all its taxes, regulations, and mandates, and Obamacare's outrageous requirement that the taking of unborn human lives be covered as so-called health care. Republican health care plans pave the way for patient-centered health care solutions. We need to focus on reform that will help reconnect doctors and patients and give patients better care through more options. The goal of patient-centered health care reform is to empower the patients. Republicans in Congress have multiple proposals to address the health care issue. Republicans propose increasing competition and transparency in health insurance market and stopping frivolous lawsuits against doctors and hospitals. Americans should not be forced to buy into something that simply doesn't work. The Non-Affordable Health Care Act does not work. The estimated premium increases that were announced yesterday are yet another example of the failings of this bill and this president. Thank you, Mr. Speaker, and I yield back the balance of my time.
Gentleman's time has expired.